Welcome back to another episode of the Coffee, Commerce, and Catechesis podcast. Join us on our journey to learn more about the Christian faith and how we can live it out in our modern world. I want to kick this episode off with two statements. The first is, a male is always a male, and a female is always a female. The second is, it's wrong to kill babies. At one point in time, these statements were obvious, but unfortunately, they are now controversial. That's why we're here today with Dr. Stefan Pokall to get his thoughts as a medical doctor. Over to you, Travis.
Thanks, Rigel, and thank you everyone for tuning in for another episode of Coffee, Commerce, and Catechesis. We are tackling messy topics today, and I think important topics, especially for us as Catholics trying to live a Christian life in the increasingly woke Western world, where, as Rigel mentioned, some of these moral issues are deeply concerning and becoming ever more prevalent and things that we need to think about. So to frame the conversation, I'm going to pull a quote here from an interview that was done by Dr. Miriam Grossman, who is a child and adolescent psychiatrist, when she was discussing her book that she wrote in 2009. So this is going back quite a ways now. But her book was called You're Teaching My Child What? A Physician Exposes the Lies of Sex Education and How They Harm Your Child. And in that interview, she said as follows, "I'm a medical doctor, and I scoured the literature for the latest on sexually transmitted infections, how girls are more vulnerable emotionally and physically than boys, what kids are told about the same-sex attraction, gender identity, and many other topics. Kids are being told that they can be male, female, or something else, that there are more than two genders, and that it is natural to question who you are at any time in your life. This is madness. It's not only medically inaccurate, it confuses our kids, and it leads them into a minefield of emotional and physical hazards." So that's, there's some heavy stuff in there, and we're going to talk about some of those heavy things with a medical doctor. And so we like to join Stefan Pokall, a medical doctor, to the show. Stefan is a dedicated family physician and pediatric surgeon with 18 years of experience and 7 of those years as a board-certified surgeon at pediatric surgery departments across Germany, Switzerland, and Austria. In 2023, he became a board-certified family physician and started his own office as a family practitioner and pediatric surgeon in Lower Austria, near Vienna. He loves to be responsible for the health of human beings from birth to natural death. So, Dr. Pokall, thank you for joining us today.
Well, thanks for having me. Hello.
So, it's very early in the morning for us, mid-afternoon for you, but we've all got our coffees, so we're properly caffeinated for this conversation. And we're talking about things that are anything but easy, I think. And it's especially anything but easy when we try to think about these complex moral issues that have gained the Western world's attention and do so while being practicing Catholics, because our views are already unpopular to begin with, and they're particularly unpopular when it comes to anything touching these issues, specifically transgender or gender ideology, abortion, etc. So maybe, before we dive into all of that stuff, would love to learn a little bit more about you. Can you tell us a little bit about your career journey as a committed Catholic who is practicing medicine?
Well, I will try to just tell a little bit, but since I have been at many institutions, it's a little longer. So, starting from graduating from high school, I first wanted to become a combat pilot in the German Air Force. But then actually was involved more and more in bioethical discussions at that time, in the late 90s, and got to know good Catholic medical scientists and physicians through Opus Dei, actually. So that time that I decided to study medicine, and instead of going to the armed forces, worked as a community service at a hospital in Berlin. So I wanted to choose between going into palliative care or fetal surgery as 2 areas where I could be an integrated part of the medical world and still remain Catholic. So fetal surgery, to explain, is a kind of prenatal therapy coming from the pediatric surgeons, where you deal with the unborn patient and have certain diseases or inborn errors that you can treat before birth so that the outcome after birth is better than without that surgery. So Well, we will see what happened later. So during surgical residency, I had several mentors, but never really found the one who could help me to combine my ethical standards and professional goals. I had one of my best times during a 3-year research fellowship in Cincinnati Children's Hospital and St. Louis Children's Hospital, doing basic molecular lab science at both institutions. And when I got board certified in pediatric surgery in Austria in 2016, unfortunately, I broke up with my mentor at that time, who blamed me, to give an example of a Catholic physician, who blamed me for being interested in fetal surgery only because I was against abortion. So we broke up about this issue, and the following years, I could not really find an institution in Austria, Switzerland, or Germany where I could go further into that field. And to be honest, I also wasn't an easy team player or an easy one to work with for my bosses. Always being scientifically critical about the established medical standards, looking for the optimal approach, several times being very undiplomatic and not really, crossing the line, with the boss and so on. So finally, I was not able to achieve my goal to become a fetal surgeon for a renowned pediatric surgeon. And that was a time when I went to residency again to become a family physician and to start my own practice. So now I can provide medicine as a family physician of the public healthcare system. And among the whole age spectrum, I also care for many patients at their end of life. So finally, I became a pediatric surgeon and a palliative care physician.
Awesome. So, Stefan, you're based in Europe, and we were based in North America. I was born in India, raised in Thailand. We know that the state of gender ideology is kind of different in different parts of the world. So, as a good example, I grew up in Thailand, where sex change surgeries are pretty prevalent. But the thing that's missing in Thailand is like there's no sense of like indoctrination. Like it's not systemic. And so I'm just curious, from your perspective, what is the state of gender ideology in hospitals, clinics, and research institutes in Europe specifically?
Yeah, well, to be honest, that is not really my specialty as a family physician, but even as such, practicing medicine in a rural area of Lower Austria, I do encounter transgender patients seeking hormone therapy to continue their transit, their medical journey. So there are already many people who are trans people, and we have to deal with them. In my practice, though, I do not administer hormones for this purpose, but try to explain those people that I doubt the scientific justification of their medical treatment and manipulation of their body. So that is oftentimes there's a saying for that. I miss it in English. So that is sometimes you can't really do anything. They would say, okay, and they would go. So they would go to the next one. But to try to explain to them what your standpoint is, maybe it makes them think. And you do care for their general well-being, of course. I mean, if they come to me and they have a high blood pressure, they have sugar problems, they have what else? Psychological problems, they definitely will have. Then I try to help them, okay? But I do not, I do not administer the hormones they need. The majority of physicians in Europe do not object to those therapies, since there was a shift in psychiatry from treating the actual disorder to treating and affirming the feelings that accompany those disorders. So even still calling them disorders can cause a shitstorm. So on the other hand, in Europe, we already abandoned pubertal blocker therapy, luckily. That is seen here as child maltreatment, mostly because of the gender-affirming hospitals in Tavistock, which was closed because of malpractice lawsuits.
Right.
So I think in that instance, we are already a step further here than in North America, where even the pediatric associations still defend pubertal blocker therapy.
I think, and I think what you're explaining there gets to what Rigel was mentioning about how in different parts of the world, the technology isn't necessarily different. Maybe even the standards for what is deemed true healthcare aren't different, but there are ideological things driving certain places more than others. We might see it everywhere, but it'll be more pronounced in some places. And I think from what we can observe being here in North America, certainly in Canada and the US, we are not opening our eyes enough, I think, yet to what in Europe we are starting to see surrounding, how devastating and dangerous these affirming practices, however so defined, can be for young people, and the irreversible consequences of it. And so in some ways, I'm hopeful because there are places around the world, like in Europe, where this stuff is being paused or halted entirely. So I'm hopeful that we'll get there, but we're not there yet here in North America, at least not at large. And that's, disconcerting for all of us. And before I get to my next question here for you from your medical practice perspective, just an anecdotal story. My wife and I talk about this often. The gender ideology piece was actually, I won't say a major reason, but it was a reason in us finding the Catholic Church, because the Church's, declaration that truth is something that we can know and we hold to that was very appealing in a culture which just feels like nothing is truth, like everything is relativistic.
The thing that used to stand for truth, which for the secular world is science, no longer adheres to truth anymore. So faith is where we go. Yeah.
Precisely. And so it was for that reason that my wife and I, when we were seeking meaning, that was one of the reasons that attracted us to the Catholic Church. And since we've become Catholic, something that my wife has reflected on a lot. So if anyone sees my wife, like, she is a beautiful woman, and there's no question that she is a woman. Like, there's no doubt in anyone's mind. But when she was a child, she was a tomboy. She loved playing sports. She had two older brothers. She loved playing sports. She liked wearing baggy clothing. And she has, and that's super normal. And she has thought often that what if the prevailing narrative that is common now had been, what if she'd been born 15, 20 years later, the things that she might have been told would have been vastly different from, this is a phase, you'll grow out of it. And shocker, she did. That is not what she would probably be told today. And so she's reflected on that, about how vulnerable she could have been to some of this stuff that would lead her potentially to affirming care and everything. So that leads to my next question for you, Stefan, as a doctor. When did you first start seeing any of this gender ideology stuff start coming into the field of medicine? Are you aware of when it started to be something that you had to think about at all?
Well, I can tell you, I mean, the first time I came in contact with these issues was as a family physician in rural Austria. So I had my practice open, and suddenly there were two transgender patients, two girls transiting to being men, who came with their syringes of hormones and asked me to give them an intramuscular testosterone doses.
Wow.
So I was shocked. I ran around in my office, frustrated. I called my wife. I didn't know what to do because I hadn't thought through this. Okay.
Right.
I didn't expect that in such an area.
Right.
So, and well, to be honest, at that time, I administered the syringe. I had a conversation with them, and I was quite insecure also in that phase of my practices. Was, I think, in the first two months, second month when I started. And well, of course, that's the time you don't want to offend your patients or something.
Yeah.
But I also was insecure, and I talked to them. I went through the accommodation reports of psychiatrists, because they are not really scientific. They just tell them what they want to hear.
Exactly.
So, and I read through this and I couldn't believe it, So there they were. It is not just something that's written about in newspapers and social media and whatever. They are there.
Yeah.
And I was shocked, and I gave them the surgeons, but I told them, unfortunately, they can't come back to me. So, and I told them, they can all the time. They can come back if they want to talk about their journey and what else.
Yeah.
And I mean, you could screen through the psychiatrist's accommodation reports what they already had been suffering. Of course, I mean those individuals are suffering.
Yeah.
And you have to help them, but it's just the wrong way to help them. And I am not a psychiatrist, okay, but there are psychiatrists, and they are attacked those days, still in Europe, that provide a different view on all that, and still are there to treat the disorder or to care about the disorder, and not to affirm the feelings that come with the disorder.
Yeah.
I mean, that would be like if you have a disease and you have pain, you just increase the pain to heal it.
Yeah.
That's a really good analogy.
That would be exactly against the principle that you want to avoid pain.
Yeah.
Okay. So in that case, the pain is actually the feelings that you have being in the wrong gender. Yeah. So but that was the first time I was really in contact with those patients and with this topic. Before being a pediatric surgeon, never. Because we are, in the US, there are some, but they're usually plastic surgeons or urologists who provide the surgeries, the mutilating surgeries. So we don't, pediatric surgeons, we don't do that. Yeah.
Right.
So we treat hermaphroditism. So in different genitalia, some of us specialize in that, but usually not alone. That's always together with plastics or with gynecologists or something like that. And during medical studies, university, that wasn't an issue. I went to medical school 1998 to 2004. So never. Abortion, that was always an issue.
Sure.
But transgender, no, that just came, I don't know, the past 10 years. 20.
Yeah.
So that was the case. That was the story with my transgender patients.
Something about, I think one of the reasons that the gender ideology stuff just strikes a chord with me is because there are indeed, and you mentioned it there are indeed people who are seeking potentially surgeries, hormone therapy, whatever it is, who are truly suffering. Like they are experiencing intense discomfort in their lived reality. And I think the reason that resonates for me is because in my family, there is a deep history of mental illness. And so you can't see the suffering outside necessarily, but there have been many, many suicide attempts. People been hospitalized potentially indefinitely. Like we're literally in our family going through this again right now with another member of our family. And you can't tell from the outside when you physically look at these people, the amount of suffering that they're dealing with. And so I think from the gender ideology stuff is there are legitimately a lot of people that truly do feel like they are in the wrong body. And though you can't see it from the outside, it doesn't mean they're not suffering. Now, having said that, the fact that resonates, the answer is not to tell them to mutilate their bodies. It can't be that. It also can't be just tell them whatever they want to hear in that moment, because that is not a true solution. No different than if you have people who are, hallucinating and imagining that there are, awful things going on in the world around them. To just tell them, it's like, yes, you're right. Those monsters are chasing you, as an extreme example or whatever. Is that love? Is that kindness? I mean, you might be telling them what they think they're experiencing, maybe what they want to hear, but I don't think you're helping them. And I don't think anyone would argue is like, yes, keep telling them that the ghosts are there, that they're chasing them. Keep telling them that all these hallucinations are in fact happening. But that is generally what seems to be the case when the gender ideology latches itself onto these people who are potentially in a place of real suffering. And that, I think, is why this topic resonates so much for me. Now, taking that as kind of a backdrop, Stefan.
Actually, Travis, I have a quick comment to add there. Stefan, you've mentioned a couple of times that, that when people come in, they have issues, like your goal is to help them. But I think that in itself has become like a word that's been twisted, right? Like your goal as a doctor to help them is to do what's best for them, not what they want for themselves, right? Like, if I came in and I was like, hey, I want to be taller, but it's going to destroy my knees and cause me health issues in the future. Like, I would hope you as my doctor would say, this is not a good thing to do. Like, it's going to affect you negatively in the future. Like, I would hope that you would tell me the truth. But these days people are like, no, I want you to just tell me that I'm right and do what I'm asking you to do. And that's not the job of a doctor in any place in the world, I hope. But Stefan, you also mentioned that, in that moment where you were confronted, with these two girls that were transitioning, you did administer the shot. But I just want to point out, like, this is why we talk about these topics on this podcast, because we as Catholics, we really need to be thinking about ongoing issues deeply before we're confronted with the moral decision, right? And because, like, in that moment, like, we just panic, and then we really don't know what to do, and then it's tough to make the right decision in those moments. So thank you for sharing that, first of all, because obviously not easy to do. So over to you,
And it's the
Travis.
same with the topic of contraception.
Yes.
So if
Yeah.
you do not have a prepared opinion, and you offer any alternatives, or you try to
Yeah.
talk to the patient, I mean, they are hammering you with phone calls that they want to continue their prescription for this and that contraception.
Yeah.
And if you don't tell your assistants what they have to say at the phone, you're on a slippery slope, providing what you actually don't want to provide. So
Right.
it's a whole issue of the whole team. You have to educate your team. You have to post certain things in your office, maybe in the waiting area, so that people know. Some people say they don't do that because they would offend those who would come, want a contraceptive, and then realize, oh, you don't give them, and then you can have a discussion. While I have something posting in my office so that people even read that and see, he doesn't do that, so I'm gonna go. So I do not reach those, okay, but I declare why. I have scientific reasons for contraceptions why I don't prescribe them. 3 or 4 things, very important things. And I can provide all the literature and so on. And I had some discussions already, also with women who said, well, and there are many women now who want to be natural. So who want to? There's an own LinkedIn group that's natural womanhood. That's fantastic. I'm the only one who likes it, but I'm a man. So. But this is great, and also under other restorative reproductive medicine, for example, as an alternative to IVF and stuff like that.
Yeah.
People are looking for that, and they are interested. If you tell them, well, I do not provide contraceptive for this and that, but I can educate you, or I can provide you informations for physicians or couples who could educate you in a natural family planning methods and so on. And I think this is something that makes hope, because all the things that are bad with wokeness and green stuff and so on, but this might be a point to discuss where we have a point.
Yeah.
So, Stefan, you're not just a medical doctor; you're also a father. And so,
Father of seven,
Rigel,
no less.
exactly. So you are an expert in the things that Rigel and I are. Rigel has already started his path. His daughter is here. My son, God willing, will be here soon. And by the time this episode airs, will, God willing, be here, and I'll be sleep deprived like Rigel is right now. But you are a father, and so not only can you think about things like gender ideology and stuff from the perspective of medical practice, but you can also do it from the perspective of protecting your own children and thinking about other people wanting to protect their children from scary things. Are you, as a father, are you scared about gender ideology now that you've actually witnessed people who are looking for these sorts of things from a medical perspective? Like, are you worried as a father yourself, or do you still feel like you're pretty insulated from this ideology that has sort of overtaken parts of the Western world?
Oh no, we are not insulated. I mean, my kids are in public schools, so and we don't have those Catholic schools you have in the U.S. or in Canada.
Right.
If we have Catholic schools, they are also kind of governmental, so they are kind of paid by the government, and also the teachers and all, especially religious education is quite bad if you see it from an Orthodox Catholic standpoint. So
Yeah.
that's not comparable. So it doesn't matter if you send your children to public schools or to Catholic schools.
Wow.
You have the same. And so, for example, my two, what would that be, sophomore and I don't know. So they are fifth and sixth graders in high school, and both of them have in their class they have one comrade, one of the class
Yeah.
who is a trans child, so to speak. So is a
Right.
girl but wants to be called a boy,
Right.
or vice versa. And the others, I'm not sure now. I think in primary school, no. But then it starts, and they have discussions, of course. And my kids are always the ones everyone is pointing at, because they are usually the only ones who against abortion, and who doubt that transgender medicine is the best thing you can do today.
Right. Right.
But this is because we have discussions at home. We read certain things. We have support in the parish. We are, of course, in some kind of a bubble, but I would say we are in a bigger bubble with our bubble,
Yeah.
So and and for us, it's easier to poke it, and then to be in the bigger bubble and to
Yeah.
talk to the people. So. Yeah, I'm not scared in so far that I think they are still free to say what they want.
Yeah.
But I hope, well, in the public, in the public, the discussion sometimes turns into bashing, into
Yeah.
canceling, and
Yeah.
and that is sometimes something that scares me, because we had a history in Europe of fascism, and
Exactly.
now people are not realizing that they are playing a new way of fascism, and you can't
Precisely.
you're not allowed to call it that way, but
Yeah.
definitely it is. Most
Yes.
of the wokeness saying and discussions and argumenting is fascism, because they
Exactly.
don't allow the other side to provide their arguments. They do not discuss. They just cancel them out,
Yeah.
and and don't allow them to speak. So what else is that than fascism? And but if you say that, you just pull another hammer out of your pocket, and it's not really helping in the discussion. So you rather don't say it. But the tactic is the same. You do not accept the other one in simply silencing him or her. And so that is nothing that I want to be part of political the political atmosphere or the democratic system that we are living in. But unfortunately, the majority of people will vote for mainstream talking politicians. Um, and we are not America. I mean,
Yeah.
Yeah.
I was surprised, and I must confess positively that Trump won. Um, I don't
Us
really,
both too.
Yeah.
I
But
don't really.
happy that he did.
Yeah.
Well, but I have to be careful with that in Europe.
Yeah, for sure. Yeah.
I also love Anthony Branco's comics, but so yeah, that is something you rather keep your mouth shut here,
Yeah.
Hmm.
because there are many things, and of course, not everything is great with Donald Trump,
Of course.
Yeah,
and
of
there
course.
are
Yeah.
many things, many issues that are doubtful, or where he has to change, especially in his diplomatic international play. So,
Hmm.
but I'm not a politician, but I need to be interested in politics as a father. Otherwise, I'm irresponsible.
Yeah.
So we need to discuss those things at home. We need to know where we live in. We are not Amish. Um, so we got to deal with all that. Yeah.
Yeah.
A couple things you mentioned there, Stefan. First being that you said you're still hopeful, which is good news because I'm trying to maintain that same hope, right? That even though our kids are going out into the world, we still have our God. He's loving and He is all good, and so we have a lot of hope, and and we have good reason to hope. But at the same time, I also hear, an abundance of stories. Just like you, we have the public school system here, we have the Catholic public school system. But regardless, there are stories that come out where it's just, there's a mental health crisis going on throughout the world. It's not just the kids who are the most vulnerable, and they are affected significantly, but it's also the adults, meaning the teachers in their classrooms that are teaching them. So if we send our kids to certain school systems, they're not only influenced by their friends, the fellow classmates that they have, but also the teachers that are in the classroom, right? And so when you hear stories that a kid, like a really young kid, might say something to their teacher where it's like, oh, I think boys are yucky, and then the teacher suggests that they might be like part of this LGBTQ movement, as opposed to just you're just too young. Like I thought girls were icky at that age. So there's that part still worries me. But yeah, it's good to hear from a fellow parent. And by the way, I'm also very conscious that hearing these stories is normal because we have a Catholic circle of friends, and so when we hear these stories, those are the ones that stand out. And when there's a story of someone just following what is good and true, and demonstrating Catholic values, we don't hear about that as much because that's normal for us, and so it's not like an outstanding thing that becomes a
Mhm.
story that gets spread, right? But yeah, if you are an expert in human physiology, you are a doctor. What do you think is the most dangerous part about gender ideology? And I don't want to limit this answer to like necessarily the social issues, but like you've read the scientific literature. What is the biggest issue that you've seen?
Well, one of the biggest issues it is that all those transgender therapies are based on flawed studies.
Mm,
Mm.
So
Wow.
there have been studies in the Netherlands, where everyone is referring to, which are simply bad from the scientific point of view.
hmm
And I cannot discuss that in detail here, but there's enough evidence to say that in all other areas of medicine, that would not have been the starting point for a evidence-based therapy.
hmm
Yeah.
So, and I mean, to start with the very simple things, there are only two sexes, male and female. In
hmm
every cell of the human body, this is detectable. So, what is all this about?
Yeah.
As physicians, you are lying to yourself if you change someone by mutilating his genitals so that he is not anymore a woman. I mean, sorry. And then the other most important thing, or most dangerous thing, which is done consistently in transgender medicine, is to violate the very principle of medical action anyway, and that is nihil nocere, so do not harm.
Mm.
Yeah, absolutely.
Yeah.
Because that's what mutilating surgeons are doing all the
Yeah.
time.
Yeah.
And that is not medicine. That is maybe plastic surgery, which is in some instances also not medicine. It is, in my view, it's only medicine if it is restoring, if it is scar reversal, stuff like that, plastic reconstruction of congenital malformations, all that stuff, But if it's just for, breast enlargement,
Cosmetic purposes.
pushing up your boobs, or what else, that is not really medicine, or at least not the one that you um, make a vow for or something. So those are two things that I think that are grave violations of the actual foundation or the principles of medical science.
Yeah.
And definitely long-term studies, and they will be done.
Mm.
Long-term studies in those transhumans will show that in the majority of cases, transgender therapy does not help but harm.
Yeah.
And
Yeah.
some scientists and some physicians are already seeing that and trying to transmit this information to the medical community, but it's hard.
Yeah.
Yeah,
Yeah.
it doesn't. They don't want to hear it. Yeah.
That's so well explained, and it's frustrating to hear from a medical practitioner to say that this is what's going on in the medical system, because I think we all kind of assume that the first thing doctors ought to do is at least not cause harm, right? Like we all go to a doctor hoping the doctor can help whatever malady we're facing, whatever problem we have. We hope a doctor can fix it, right? And sometimes that can't be done. But I think we all know that we don't go to a doctor thinking the doctor will do the opposite, which is to cause us harm at a starting point. And yet, when it comes to these things, I think you're exactly right, Stefan. And I'll take this outside of the world of gender ideology and stuff, and say cosmetic surgeries purely focused on breast enhancements. Even my wife is Colombian. In South America, there is a huge industry around butt implants, and my wife gets talked to regularly by members of her family social circle about, when are you going to have plastic surgery? My wife doesn't need plastic surgery, but it's just like inculturated into her. And so I can see how
And that is the
easily it
same.
is.
That is the same with lips enlargement, and
Yes.
that is at some areas of the world it's very popular, and it's like
Yes.
a fashion.
Yes. Yes.
Yeah.
Exactly it. And so I think about that, and I can't help but reflect on the Imago Dei, that we are all created in the image and likeness of God. And I don't want to take that too literally. I'm not saying that we are literally made to look like God. Don't misunderstand me, anyone who's listening. What I'm saying is, there's something about our maybe obsession for some people about making ourselves into whatever we want to be. And I think there's something about that is implicit in the gender ideology, is that nothing that's given to me, including my genetic makeup of man or woman, is going to stop me from making myself into what I want to be. That is really frightening for me to think about as like an underlying part of this gender ideology. So, Stefan, as you think about what you're already seeing in medicine, having encountered people that want hormone therapy or whatever directly yourself now, what do you think the future of medicine looks like maybe in the next decade or two? Because we don't have these longitudinal studies yet, but like you said, they are going to come, and they will almost certainly show exactly what we all know, which is this is generally bad for most people most of the time. But until those studies are done, what do you think the future of medicine is, given how powerful this gender ideology is in the popular culture today?
Well, I just think it's dealing with the reality on one side, because we cannot change it. We just can, as Catholic physicians, or there are also other physicians who are not Catholic but are against this movement, trying to provide an alternative and telling the people, okay, I doubt that you are treated right. I'm sorry for you, but I won't provide you what you want or what other physicians told you is the right thing to do. It's living an alternative and being prepared and looking at what's the data, and they will see their flaws if they look at the data seriously, even now the short term or midterm data, and they will have to admit that they went a wrong direction, not to prove us right, but to help those humans to deal with the consequences of their wrong medical treatment,
Exactly.
because the aftermath is long. And So the future for the next 10 years, I don't know. I mean, we will pretty much have a status quo like that, which is now. Um, so having people that defend this and provide it as this new standard of care, and that is against the freedom of the people if you do not provide it, or that is even unlawful if you don't provide it. That could be the case, like it is the case for abortion or for assisted suicide, euthanasia. So these are all subjects where the public and the law, driven by democratic decisions, will be changed. And we have to ask ourselves, and also to ask that our children, how far you want to go with such a society, and if at some point you need to say, okay, I can't follow that law. Uh, and as a physician, that might be in America, for a gynecologist, that someone comes to you and wants an abortion pill, and you do not provide it, and then you are sued
Yep.
because you didn't provide it as a standard of care. Or yeah, you didn't provide assisted suicide even though the patient wanted it, and another doctor had to do it. So I don't know who, but maybe someone could sue you because, I don't know, you were causing problems. What else? So I'm making this up. There's, to my knowledge, there's not such a case so far, but there are already groups among physicians, and even among family physicians, who advocate for assisted suicide, and others are not, but they are usually not that loudly or that well heard in the public,
Yeah.
because the public opinion seems to go in the direction that also this topic will be a case of individual decision and of individual so-called freedom, so that anyone can kill himself when he wants, um, and especially in a long-term illness and stuff like that. So I think we just need to be prepared that we live an alternative medicine in this way. And there, in the 90s or the early 2000s, the alternative medicine was something like with herbs and with oils and ointments, and maybe anthropologic medicine, and global eye and stuff like that. So we need another alternative medicine today, and that is simply a anthropologic, naturalistic, Catholic medicine. And the prime example for how this can be done is if you just look at the website of the Catholic Medical Association. So the American Catholic Medical Association. Um, I am not aware of any other Catholic association in the world that provides such a scientific alternative than they do. And they have an annual conference where they discuss all the topics that you're dealing with as a physician in our society. And that for me is a good way to show people, okay, there are other physicians, but it is difficult because on one hand you have to try to live an alternative, but there are also those people who say, well, we have to continue a dialogue with the others, with those physicians who don't understand us, or who even fight us, And that is a difficult issue. And we are already discussing this here in groups, because we are forming so-called Physicians for Life groups here in Austria. And among this group, this is a discussion, how far do we want to go? Do we want to be open always and not that clear in our statements, not to offend the others?
Right.
Or do we just say what we think is right and what we think should be provided and what we do, and we show all the alternatives like NAPRO, like reproductive restorative medicine, like help for post-abortion syndrome, all those things that are not publicly talked about, but of course would put you in exactly the Catholic corner where everyone said, yeah, of course they do that, because they're Catholic. No,
Right.
the other way would be not to hold the flag with Catholic, but to do something from a scientific point and from medical arguments, so that people are not offended by the Catholic label already. At least that's the case here. I mean, in the US, it's really different, because what the CMA does is great, and you just know what you have, you know, and that is something that's not possible to develop here, because everyone would laugh at you. I mean, if you want to, found a Catholic Medical Association of Austria, ha ha ha, yeah. So that
Right.
is, it's just a different society.
Okay, so let's switch gears a little bit here, Stefan. We also wanted to talk to you about this ongoing culture of death that exists in the world, whether that's euthanasia or abortion. We're talking specifically about abortion. It seems, at least to me, looking in, that people have come to this point where they're all for the act that leads to conception, but they are not okay with the consequences of the act. So what they really want is freedom of consequence, right? So they want to do whatever they want to do without dealing with the consequences of whatever they want to do. Now, for you as a medical doctor in Europe, what has your exposure been to the abortion industrial complex in Europe?
Yeah, well, first of all, I would question what you mean with industrial complex, because it is just integrated in the medical world here like any other discipline. There's not an own institution there with an abortion industrial complex on it or something like that. You have it
Yeah.
in in almost every public clinic where you have a gynecology OB-GYN department. Well, not everyone, of course, because you always need those guys who specialize in abortions. And so, well, I was first exposed as a student. I did a clerkship in Zurich in Switzerland in an OB-GYN department, where I knew that there was one pro-life OB-GYN who was actually doing prenatal screenings, so prenatal diagnostics, and he was a geek in that, so he just was sitting all the day in his little chamber, dark chamber with a sonography, and not doing nothing else, and everyone in the department didn't let him do anything else because he was pro-life. So, and I was doing my clerkship pretty naive,
Wow.
and I was going through the different areas of the department and so on. And suddenly, one day, I was taking part in outpatient clinics for prenatal care, and then they walked in. So women that were consulted to have an abortion, and I stood there and I was thinking, wait a minute, what am I doing here? Why? Am I in the wrong place? What? And so I started to discuss with one of the attendings why they just do it like it was normal, and he just said, "This is business." So, and that by that point, I told them, yeah, I can't participate here. I need to go to another department of OB-GYN, and I went to the delivery room and stuff like that, and I never touched that field again. But if you're just a student and don't have any opinion, you walk through this garden, and you do not really know what type of plants you are seeing and you are even consuming. So that is not a complex industrial industry. It is simply there. It is normal life. And if you're not aware of what's going on, you're sucked into it. So
Right.
I think many of those who are providing abortions did never really think about it. And maybe they are also people who in general don't really think so much about what they are doing. So
Yeah.
so I mean, you can be a physician and just be a numb guy, uh, and just do, I don't know, like an electrician, or like a plumbing guy, or like a carpenter. You just do your stuff and you go home, and you come back again, and especially in surgery you can just be a technical idiot, type of thing. You're just a geek in your instruments, and in your screws, and in your um, scopes, and loops and everything. So, of course, and that is all good. I mean, you can be a good physician doing that, but in many areas, you need to think about what you're really doing, and not just providing it. And if you are a physician who studied the human development, who went through radiology and knows what a prenatal ultrasound is, and you're doing an abortion, you exactly know that you're killing a human. You're a killer, nothing else. And who says no? Oh no, this is just not a human. I mean,
Yeah.
I'm sorry. How many years did you study? Um,
Yeah. Totally.
I mean, that is insane. So people who are providing that know exactly what they do, or they just don't want to know it,
Right.
Yeah.
because otherwise they could not live what they are doing.
Yeah.
There are many
Yeah.
people who work in an environment because they have to do the work, because they have to earn money. They have to show someone that they are capable of doing something. They have to, I don't know, provide for something, maybe show themselves something. I don't know. But there are many reasons why people work. And in the abortion industry, that's the same. So, I mean, there are probably many people in Planned Parenthood who never really thought about what they are doing.
Yeah.
Yeah.
And who are just thinking, "Oh, I'm doing a good job. I'm helping those women."
Yeah.
Yeah, and it's great. Yeah.
Yeah. And I think we could look at other industries too. Like, thinking back to when I worked in asset management or whatever, like I don't recall at any point in time doing anything that I thought was wrong. I mean, I wasn't practicing my Christian faith at the time, but there was never a point where I thought I was doing anything wrong. But I was also a cog in the wheel. And could I have been just accepting things like this is how you be a good analyst? And well, there are a lot of people out there who are good
And you
analysts, if we use
cannot
that term.
accuse and you cannot accuse many people of doing that,
Yeah.
Yes.
because
Yeah.
um, it needs a lot of backbone
Yeah.
to
Totally.
not do that. And not
Yes.
everyone. I mean, my wife suffered from the many steps I had in my career,
Yeah.
and that is something your whole marriage
Right.
can suffer from.
Yeah.
And
Totally.
not every marriage can stand that.
That's right.
And if you are trying to, calm things down and maintain a sense of peace, and regulating your life, and that everything is going smooth, that is something, and that's an own value, and so some people are not called to stand against the public mainstream or something, or are not even able to do that. And you cannot accuse them. And I wouldn't say that I'm the only one who's doing it right. So and that is very dangerous as well.
Yeah.
So it's a one thing to live a virtuous life, but it is another thing also to be a missionary.
Yeah. To
and
share it with the
and
world. Yeah.
Yeah.
the one is not better than the other.
Exactly.
So the one who is virtuous and living that in his chamber, or in his small town suburbs or whatever, and no one notices, can be a saint as well.
Exactly. Yeah, that is so perfectly stated, Stefan. And I think even thinking about myself, I mean, I'm pretty cavalier. Like, I do not for one second to pretend to believe anything other than I do on social media and stuff. I welcome people trying to cancel me. Like, as the more people try to cancel me, the bigger my LinkedIn network seems to get. So it's like, keep trying because you're failing. But I also would almost never advise someone to do what I do, which is unapologetically share the messy parts of our faith,
When I
call
started at
evil what
Link,
it is.
yeah, when I started at LinkedIn, I loved to play a troll, you know. So, but by that, I also, I developed my followers and stuff like that. So
Yeah.
I'm not
It-
anymore. I'm not touched by those people, and I don't touch them
yeah,
because it doesn't make sense, and it's not. Social media are not really something where you learn to debate or something, or where
yeah,
you
Yeah,
learn
100%.
so true.
to present yourself. And there's so many. Yeah, it's not. It's just, I think it's good for showing something, for giving an alternative, for
Yeah.
showing others support, and yet that you love certain things and stuff. But it's not really to discuss. Most of the times, it's not.
So maybe by way of bringing us to the conclusion here of our time with you, Stefan, which I wish we had more time, because I'm sure there's so many other things we could talk about, but I would love to get your thoughts as a medical doctor. And you had said that we don't even know necessarily how to define abortion industrial complex. We could probably say it's because it's been so effective that it's now just part of the healthcare system. And so, given that that's the case, that's certainly the case here in Canada, where Rigel and I live. Abortion is just either seen as a good or just the way things are. And very few people would even question that. Given that that's the case, are you optimistic or are you pessimistic as a doctor when you think about the status of the abortion debate in the world today? As a doctor, what is your view? Are you optimistic or pessimistic?
Well, I'm always trying to be optimistic, because being a father, what else should you do?
Yeah.
I mean, you don't want to cause depression in your children. So I'm optimistic, because abortion today is sold to the people as means for emancipation and self-determination of women.
Yeah.
So, and that is something we were brainwashed from the 90s on, or from even earlier. And so everyone is believing that. So, and they can only be persuaded from examples they know, and they experienced themselves, because that will open their eyes. I mean, there are um, pregnancy support centers in Germany and in Austria who provide data, numbers, graphs of their counseling, showing what the real reasons for abortions are, where these women coming from, what they're thinking, and these data, they're not gathered objectively. So there's no institution, governmental institution or something else, that gathers reasons for abortion or something like that. So,
Right.
and that is a blind point in the eye that more and more people need to look at. And also, what is the most powerful thing today is the social media and the journalists, who are still avoiding to look at those data, who are still fighting a fight for emancipation, self-determination for women. It's like a babbly babble all the time. So, and that's blinding for the reality, what's going on with those women and with everything. I mean, intelligent people will study the data about what really happens in abortion and what is the status of the unborn life, as well as the bad aftermath of abortion on women and society as a whole. I mean, there are 73 million humans missing worldwide every year
That's
because of
that's
abortion.
shocking. That's
And
crazy.
in Europe, that means missing people for the public health system and retirement plans. I mean, the whole system will crush probably in 2050 or 2060.
Hmm.
And that's not only because of the aborted children, but it is mostly because we don't have enough children. We don't have a growing society. We
Yeah.
have a dying society. And nowadays we try to compensate that by migration. And we try, in Europe, you see that all over the Europe. In every election, that's an issue because many politicians need to integrate and to make migration one of their topics, because otherwise the system will crush much earlier. Um, and so that's reality. And so seeing that, optimistic or pessimistic, humans are humans. They are intelligent. They should observe. They should make their own opinion, view. Hopefully, I mean, there are people across society that are not Christian or not Catholic who are able to do that.
Mhm.
And so we just, if even if it is a small coalition, but we have to find them, and also hope and pray that some of the others will turn back, and will see their flaws, or will see what's all that about, and probably, maybe, I don't know when, maybe it's then the many things are already going down, the, how do you say it, anyway, are already going bad, and you can't avoid them anymore. But still, people can rethink. Um, they can change, and that's my hope. So I'm optimistic.
I think
Awesome.
one thing in there, at least that we can, take away on our own, is I think we need to do our part in glorifying motherhood a little bit more publicly. It's still fresh in my mind, like watching my wife go through the pregnancy, carry this child for like 9 months, watching her body change significantly. My wife is a pretty petite woman, and to see her belly growing the way it did, it was just like, it's so wild. And I still sit here sometimes thinking about, I'll look at my baby girl and I'll just think like, wow, that's a real human being. That's crazy. Like
Mhm.
this is such a miracle that we're witnessing in childbirth. And I think we've lost that somewhere along the way. You talked about, the emancipation of women and stuff, but I think we need to do a better job of glorifying motherhood, because it is like the single greatest thing I think a woman can do. Like, and this is not to bash people who can't, naturally have children, but it's something
I
so
agree.
unique to women, and I think it glorifies them beyond anything else that they could possibly do.
But it has
Totally.
a lot to do. It has a lot to do again with identity.
Yeah.
Mm.
And since we are missing a male, a masculine identity, a healthy
Hmm.
masculine
Yeah.
identity in the society, and also a female identity, that's all not wanted.
Yeah.
Yes.
Hmm.
The people don't really want to see pregnant women. They
Yeah.
probably want to see pregnant men. Uh,
Mm.
so yeah,
True.
and they would say, "Wow, yes, how did he do that?"
So true.
And great that they are doing it. Oh yes,
Yeah.
Yeah.
and they should do it more. And great, yeah.
Yeah.
So
That's
that is the flawness. Yeah.
yeah. That's a great line. And I think here, Rigel, right before we wrap up with a prayer, I'll just share that. I think to confirm exactly what you've said, watching, like, my wife is now 7 months pregnant, and to watch her body change, and knowing that, like, there is a human being, like this little miracle inside of her,
Hmm.
like, to just pause and reflect on truly what a miracle that is. Like, you just think about, and you, like, take a step back. It's like, if any single person ever in the string that led to my wife and I had been aborted, neither one of us could have been part of cooperating in God's will for another human being to come into the world. And that there's just something about that that's so overwhelming, right? Like the improbability that this was even a possibility, and this little child is growing inside of my wife. And I'll throw my wife under the bus a little bit. Not so much throw her under the bus. I'll just give her credit, because I always used to joke that, when she was worried about pregnancy and the changes to her body or whatever, I would always joke, I would say, you were made for making babies. And it was just like a joke kind of. But to see her now that this life is growing inside of her, and she's just like, she's so at peace and she's so calm. And it's like, I was right. You were made for making babies. And, God willing, our son will be here in a couple months' time and stuff. And there's just something about that. I think you're right, Rigel. I think we need to celebrate that and at least not be ashamed, at least not pretend that it's not the most amazing thing in the world. And I want to thank you, Stefan, for being a doctor who hasn't forgotten that. Because I think sadly too many have. And so I God bless you for being one that hasn't. And I want to encourage anyone else who's listened potentially, if you know this, but you're not saying it or you're not living it out, use Stefan as an example that I'm not saying it's easy, but it is possible to practice medicine or whatever profession you have and also recognize the miracle of life for what it is. So I think maybe that probably brings us to the close of our conversation. But Rigel, do you want to wrap us up in a quick prayer here before we let Stefan get back to his day?
For sure. In the name of the Father, and the Son, and the Holy Spirit. Amen. Lord, we are gathered here today in your name. We ask that you come down and be among us. You know our hearts best, and you know that we are gathered here not to spread hate, but to address an ongoing injustice and perversion of your design in the world. We ask that whenever we have these sensitive conversations, we can be delicate and loving, but firm and resolute, just as you and your most holy apostles would be. We ask for their intercession and your grace to empower us to do our part to spread your truth and your love in this world. We especially offer up Stefan and his family and his practice. He is your disciple doing your work and putting his livelihood at risk to do your work. So we ask that you bless him specially and give him all the things that he deserves in this world and the next. We ask all this in the name of our Lord Jesus Christ. Amen. In the name of the Father,
Amen.
and the Son, and the Holy Spirit. Amen.
Thank you very much for this blessing.
Yeah, thank you, Stefan, sincerely for being willing to talk about this, because I know it hasn't been easy for us to find a medical practitioner who's been willing to talk openly stuff. So thank you so much for that. God bless you. We're going to put a link to your LinkedIn profile in the show notes here, and I encourage anyone who's listened, go and follow Stefan on LinkedIn, because he's a great source of the content that I love to consume and stuff. And he's a doctor, so he knows infinitely more than I do about all these things that we as Catholics should at least be informing ourselves about. And so we'll do that, Stefan. And yeah, thank you so much for taking the time to be here with us. To all of you who have tuned in to listen, thank you so much. This has been another episode of Coffee, Commerce, and Catechesis. God bless you.